Okay, we'll move now to Steve Kaye. Steve is going to be giving us a perspective on trends in the PAS workforce.
This presentation is about the workforce providing personal assistance services, paid personal assistance services to people living in the community. These workers could be people who call themselves attendants, personal care attendants or whatever, or they could be people who call themselves home health aides or home health workers. So we're including both of those kinds of groups. Some people separate them, we're lumping them together. And what I'll be talking about is the size of the PAS workforce, its growth over time, the relationship between that growth to Medicaid spending, and I'll be showing you some workforce data by state. I'll also be talking about the job of being a PAS worker, including wage trends and state-by-state comparisons of wages. I'll talk about hours, job hours, and benefits, and about some new data on occupational injury rates. I'll talk a little bit about who the PAS workers are, their gender, race, ethnicity, their immigrant status, and other factors. And I'll address something that Steve Tingus just brought up about meeting the future need for PAS. And this analysis is, this presentation is, part of it is an updated version of some data we presented in a journal article last July. That article is on the table way over to the left of the room. It appeared in Health Affairs in July, and my co-authors were Susan Chapman, Bob Newcomer, and Charlene Harrington. And I'm not going to have time to give you details of data sources and trends, data sources and analysis methods, but please refer to the journal article for some of those details. We used our own analyses of 3 national population surveys for this presentation, the Current Population Survey, the American Community Survey, and the National Health Interview Survey. We also analyzed the National Nursing Home Survey. We got data from the Bureau of Labor Statistics on occupational injuries, from CMS on Medicaid expenditures, and we used population projections from the Census Bureau. The number of workers supplying personal assistance services to people living in the community has quadrupled over a 17-year period, 18-year period, I guess, from 1989, beginning of 1989, when there were about 250,000 people providing PAS, to the beginning of this year, when there were over 1 million. The period of of the fastest growth is just in the past couple of years, actually. In the journal article, we said that the workforce had tripled. Now we can say it's quadrupled. And another period of rapid growth was in the early to mid 1990s, and has slowed down in between. So there is a tremendous growth in the workforce, and how does that compare to the demand for personal assistance services? That also grew. The number of people with need for help in activities of daily living grew over the period, and to get a sense of that, it makes sense to take a ratio of the PAS workers to the number of people who need help in ADLs, and that ratio in 1989 was 110 workers per 1,000 people needing ADL help, so 1 worker for every 9 people who needs help. That's not so high. But that ratio had doubled by 2005 to 221 workers for every 1,000 people. So 2 workers for every 9 people. That sounds like a fair amount. After all, most of the help people get is informal, so they're not counted in this data. But that's just people who need help in ADLs. It doesn't include other people who might get personal assistance services. A broader measure might be to use the measure that's in the American Community Survey, which is just ADL difficulty, not need for help in ADLs. And if you use that measure, you get 118 workers per 1,000 people. So again, we're back to 1 in 9. So somewhere between there is probably the truth of how of how available PAS is. But certainly, this is really good news for people with disabilities that this ratio has doubled over the past less than 2 decades. It's kind of obvious that the driving force behind this growth is increased Medicaid spending on home and community-based services, which you heard about earlier this morning. In 1989, $3.3 billion were spent by Medicaid programs on home and community-based services, and that number again had more than quadrupled by 2005 to $15.6 billion if you adjust for inflation, so $15.6 billion in 1989 dollars. In contrast, when you look at institutional expenditures, they grew, but not by a whole lot, from $22.3 billion in 1989 to $26.2 billion in 2005, again adjusting for inflation. But, you know, it's Medicaid is a state-administered program, and as Martin showed you earlier, expenditures vary tremendously. Number of people served vary tremendously by state. This is what happens if you divide the expenditures in each state by not the number of people served, which is what Martin was showing you, but by the ADL population in that state. So it's dividing the expenses by some measure of the demand in that state. And what you find is some states are very low, spending less than $1,000 per year per person with ADL difficulty in that state, those states being Arizona, which is always the exception state, and Mississippi. Other states in the South are also quite low. And the highest states are New York, more than $14,000 per person with ADL difficulty, and Minnesota. And other states that are high are the New England states, Wisconsin, Wyoming, Alaska, and New Mexico. As Doug was talking about earlier, New Mexico is actually quite good. And that expenditure ratio is clearly it has an influence on the availability of PAS in that state. Mississippi was one of the lowest before in expenditures per person, and it's also the very lowest in PAS workers per 1,000 people with ADL difficulty, 49 workers. So 1 for every 20 people with ADL difficulty in Mississippi, and the highest is New York at 268. So it's about 1 for every 4 people with ADL difficulty. So there's a tremendous range. Other states that are high, again, the New England states, again, Minnesota, Texas is high, New Mexico again, Alaska, California, Idaho, and Washington state. So PAS as a job. You don't make a lot of money. This is not going to be news to anybody. In 1989, the median hourly wage was just under $5.50 an hour, and that went up by 67% by 2006, up to just over $9 an hour, which sounds really great, except when you adjust for inflation, there's been no progress at all, still about $5.50 an hour in 1989 dollars. And that 67% increase looks especially paltry if you compare it with comparable occupations. In the early 1990s, nursing home aides actually earned a little bit less, slightly less than PAS workers working in the community. Now they earn more, about 75 cents an hour more on average. Their wages have gone up 89% compared to the 67% for PAS workers. And if you compare with fast food workers, or food counter workers is actually the category, their wages have doubled over the period. So in relative terms, they're catching up. You know, they're very different occupations, clearly.